African sleeping sickness, also known as Trypanosoma brucei, has two types: rhodesiense, which is found in eastern and southern Africa, causing 3% of the cases of Trypanosoma brucei. Usually, it is noticeable within a few weeks of infection. Gambiense is found in western and central Africa. This causes 97% of the cases and can go unnoticed for months or even years before detection. Because of this, infected hosts are usually in the second stage by the time of diagnosis. The first stage is often found in the blood, lymphatic system, and or other organs like the heart and lungs. The second stage is found in the central nervous system. Signs and symptoms of the first stage include fever, headaches, itching, body pain, skin rash, and swollen lymph nodes. The second stage includes mood and behavioral changes, weakness, progressive confusion, extreme fatigue, and heavy sleeping. If left untreated, this can cause death. Detection and treatment. The tsetse fly leaves a bite that is red and swollen and often painful, called a cancer. If suspected of infection, skin biopsy of the bite, blood tests, and or spinal taps are all tests available to detect the parasite. Rhodesiense is best tested for under microscopic analysis of the blood. Blood can also be examined for antibodies of the parasite. Gambiense is best tested for under microscopic analysis of the lymphatic fluids. The second stage is tested for in the cerebral spinal fluid. Once treatment has been completed, lumbar puncture is required every 6 months for up to 2 years, or whenever symptoms reappear, just to make sure that this disease has completely gotten out of the body, that the parasites are completely gone. Medical treatment is often decided based on whether they have rhodesiense or gambiense, and what stages they're in. Often, or not often, the medications used to treat this parasite are not available in America. So if needed, a physician would have to ask the CDC for the prescription. Transmission. The tsetse fly often bites and leaves a painful red swollen mark called a cancer. It becomes infected. The tsetse fly becomes infected when biting into an already infected host. It transfers the parasite when biting into a new, uninfected host. The vector of this disease is the tsetse fly. The reservoir is humans and domesticated animals such as cows, pigs, or dogs. Animals are the main reservoir for the rhodesiense type. Humans are the main reservoir for the gambiense type. Uncommon transmission is sexually, infected blood transfusions, and from mother to baby in utero. Vector population control is the main concern to slowing the spread of this disease. Diagnosing and treating infected hosts is a great way to also slow the disease because then no more tsetse flies can become infected. Wearing appropriate clothing and being aware of your surroundings, like wearing medium weight clothing so that the bugs can't bite through, wearing neutral colors, and covering any exposed skin, knowing where they like to live, like rural areas and heavily bushed areas, are great ways to individually protect yourself from this disease. Bug spray is not effective against these flies, but it is important to still use it either way to prevent other infectious diseases from spreading.